Planet Vero Studio is powered by the Nolan Group of eXp Realty.
Welcome to Treasure Coast Community Health. We have 8 locations to serve you better. Our staff is dedicated to help you and your family. Here's your host, Vicki Soule.
Good afternoon, and welcome to Community Conversations. If you're just joining us, you may notice that my voice is a little more gravelly than usual. A Thanksgiving gift from one of my relatives. But I'm hopeful that I will get all through today's conversation with one of our wonderful staff members without coughing and disrupting the conversation at all. So happy to have Brett with us today. Brett has been an RN for about 20 years. Unfortunately, not all of them with us because he brings with him some really superior knowledge as a wound care specialist. And we're very, very happy that he is complementing our diabetes program with his knowledge of how to assess and assist with wounds, but more than just diabetes. Brett, tell us, how did you decide? Well, I should ask you how you decided to be a nurse, but you already bought me a clue.
Yeah.
So tell our audience.
Well, I mean, my career has been long since I was 22. I started off as a paramedic about 10 years. And then I worked in hospitals in the ER for about 17, 18 years as an ER nurse. And I moved to Florida after a divorce. Like most people do, I guess. But,
Many.
Yeah.
New change of scenery.
Yeah, my dad had retired, so I knew some people down here, a nurse who did wound care. And I was looking for something a little different. You know, the ER is a hard...
It is fast-paced.
As you get older, you need to,
Yeah.
So,
you want to focus on some particular aspect of care.
I wasn't sure, exactly, and she kind of just check out wound care. And she had worked in a long-term care facility. And so I kind of went there and worked there, and the more I got interested in it, I just kind of furthered my career, and I wanted to specialize.
Well, it is something that is very needed, and I think it's probably very under-recognized, which is why I've got you here today, because we know and we talk a lot about different organs, how important the heart is and problems with the vascular system in terms of causing strokes. And one of the things that we rarely talk about is the skin, except perhaps with skin cancer, okay? And not everyone needs a wound specialist, but tell us one of the advantages or several advantages that you see in being able to treat people with wounds that are perhaps slow to heal.
Okay. Yeah. Well, first of all, the skin is an organ. It's the largest organ in your body.
Yeah.
And its primary purpose is to protect against injury and disease. And so a lot of times what happens is, any break in the skin is a portal for infection. So there's different causes of wounds. First, what you think of as an acute injury, like a laceration or a puncture, any kind of cuts and scrapes, and those are usually pretty simple. And then you have what we call chronic wounds or idiopathic wounds that are caused by disease, diabetes, peripheral vascular disease, arterial disease. And, most of those happen in the legs, and those are usually the ones that are slow to heal because there's an underlying disease.
Could I throw in perhaps aging? Because I see a lot of elderly people struggling, women especially, with skin tears on their arms. They might brush against something while they're gardening or doing things there. Yeah,
the skin, as you age, it loses a lot of its elasticity, the subcutaneous tissue, the cushioning part of it, the fat, whatever you want to call it. But as you
fat
age,
all seems to migrate someplace else, doesn't it?
So everybody knows that skin gets thin. They call it thin skin. And it can tear so easily, just catching it on the edge of a table or, like I said, any kind of object can tear it. And those are usually, like I said, superficial. It's that top layer, the epidermal layer. And
what's the best way to help that cure itself?
The best way is prevention. moisturizers.
Ah,
Keep the skin, helps it keep some moisture in it, keeps the elasticity.
okay.
And
thought of that.
sleeves. If you know you're going to be working around objects and you're going to be you could bump into things. Sleeves, little protection devices like that, because most of them are going to happen on the forearms that you see. The hands are usually the back of the hands. So it's just prevention.
Okay. And then keeping it clean.
Oh, once the skin tear does happen, yes. The most important thing is keeping it clean.
We have a debate in our house. Band-Aid, no Band-Aid. Band-Aid for sure the first day. Then the debate starts.
Yes.
Should I cover it up or should I not?
Yeah, well, initially you should cover it up. You should wash it with soap and water and just your everyday antibacterial soap.
Okay.
Works. That's the most effective way, just for any, you hear everybody wash your hands. That antibacterial soap is wonderful.
Okay.
So just a gentle cleansing. You don't want to scrub it too hard, but if there's any kind of debris, and if it is a skin tear with a flap, if you've seen it where the skin just peels
like a
back,
gouge kind of thing, yeah.
If you're able to, fold that flap back, and then that's where you want to put a bandage over it, because that skin will regrow, reattach.
Okay.
So it will increase healing time.
Okay. That's wonderful to know.
Yeah.
So most of the wounds, though, that you see probably are from the knees down because of changes in circulation.
That's correct. The main causes, especially in this population that I see, is diabetes. And what goes with diabetes is what we call neuropathy. They don't feel pain in
no
their
sensation.
legs. Yes. So they may be unaware that a wound is occurring, because usually it's a repetitive, especially on the feet, a repetitive movement for improperly fitted shoes, or walking barefoot, and they don't realize
they've stepped on something that's
sidewalk's
sharp.
really hot or something's really sharp.
Yeah.
And then so it's just kind of repetitive, and then the deeper it gets, the harder it is to heal, and diabetes prohibits healing.
Yeah, it does, definitely.
Or not inhibits. Yeah.
So if you are, I hate to use the word non-compliant. If you're not excited about going to the doctors and put it off, as many males do, okay, I'm fine. It still behooves them to take off their shoes and socks and turn their foot around and take a look at it once in a while, diabetes or not, for the same reasons, to make sure that skin remains intact.
That's true. Like I said, a lot of people have what we call peripheral vascular disease, peripheral arterial disease. They may not even know they have it, or they've been diagnosed with it, but don't think much about it.
What is it?
That's just the arteries can get, just like the heart, they get narrowed. And, and the blood flow just doesn't reach, it's that's why you see it mostly in the feet. It's the furthest away from the heart. So
the least pressure, and if there's not wide vessels, then it doesn't get down there. Okay.
Yeah, and you need oxygen and all the nutrients to reach that area to perfuse the area, what we call perfusion.
Okay.
And that, when you have those disease factors, that prevents.
Do foot massages help? I'm just wondering.
Not that I know of.
Thought maybe I had an edge.
They can increase blood flow, maybe,
Okay. It's really about the prevention and taking good care of your extremities, arms or legs.
Yeah, and like I said, here at TCCH, we, if you're diabetic, or, it's part of your annual exam, or their core measures, we try to, diabetic foot exam. If they're done. And we test sensation, do you have sensation in your feet? And we look for any signs of wounds that may be developing or that are there.
And you do it so quietly. I get comments back. They didn't do anything. It's like, oh yes, they did. They looked, they felt, they tested your sensation, but you do it so seamlessly as you're talking with people that I have to explain to them that Yeah, it really was a good thing for you to come in. They did do things. And the good news is they didn't find anything that made an impression on you for a change of behavior.
Yeah, that's what I was going to say. That's good news.
Yeah, that's the good news.
If it was uneventful, yes.
Yeah. So we're going to take a short break for a word from our sponsors. And when we come back, we'll talk more about some of the different kinds of patients you've seen and what kinds of things you might be referring on. Because people wait too long.
Yeah.
Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
Hey, did you hear the latest about our Florida Highwomen?
No, what?
There's a new Highwomen art gallery in Vero Beach.
Really? Where?
1872 Commerce Avenue.
Wow, when's it open?
7 days a week. Call 954-557-6226 for an appointment anytime.
No kidding?
Just call for your appointment, 954-557-6226, and then go to 1872 Commerce Avenue.
Wow, that's good news.
A member of the iTex trading community. Your iTex dollars are welcome.
Right now at Sunshine Furniture, it's holiday sale time. They are clearing out their warehouses to make room for new furniture styles, and this means you can save on selected styles from Lloyd Flanders, Beechcraft, Windward, Riverside, Universal, Caprice, Four Seasons, and more. Sofas, dining sets, patio groups, occasional chairs, cabinets, bedroom sets, and occasional tables. There are lots of pieces on sale from inside and out, just in time to make Santa say ho ho ho. Sunshine Furniture has the largest selection of coastal furniture anywhere, including a gallery of Tommy Bahama Home and a Universal Coastal Living collections. Visit Sunshine Furniture now for their holiday sale. And right now, all pictures, lamps, and accessories are half price. Sunshine Furniture, $12.95 US 1 in Vero Beach. Online at sunshinefurniturecasual.com. And don't forget to shop their outlet and sell store just across the street.
Sunshine Furniture.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soulé, and I'm the CEO of Treasure Coast Community Health. Now, our company has been in existence almost 30 years, but in some ways, we're still the best kept secret in Indian River County. We are trying to change that by exposure and education of all the services that we provide, which include medical, dental, behavioral health, pharmaceutical, vision services, x-rays and labs, anything that you need on a primary care basis to make it convenient and accessible for you so that you don't have to take time off work, so that your calendar can be filled with your children's activities or your grandchildren's activities instead of going to the doctor multiple times to multiple places. So in that fashion, we have expanded some of our existing medical services. We now have a diabetic certified registered nurse, Colleen Shemansky. She is one of only about 15,000 in the entire United States that is certified to assist people with diabetes, whether they're newly diagnosed, whether it's a type 1 or a type 2. It's a whole different lifestyle. And unfortunately, many of our diabetics, for whatever reason, need some additional care, whether it's having their eyes checked or, as we're talking today with Brett, one of our newer RNs, helping to deal with wounds. And it's a kind of a yucky subject, okay? Yeah. Not many people want to talk about the things that go wrong with our skin. But as Brett said earlier, it is the largest organ that we have, and the best thing that we can do is to prevent wounds from happening. Harder for diabetics to heal, so even more important for everyone as we age. He was explaining to us earlier, the skin does get a little thinner. The subcutaneous layer underneath,
the squishy part. Yeah.
The squishy part gets a little thinner. It's easier to get a tear. And so he recommended just that simple thing of if you know you're going out to work in the yard or taking a walk in the woods, wear a light garment over your arms and, watch where your hands are going so that, again, the best skin is an intact skin without any holes or bumps or tears in them. But certainly we've seen a number of diabetics that, as you indicated, their lower extremities have got little to no sensation in them. And so they're unaware that they have created a tear or a wound, a puncture, whatever, in their lower extremities. And we all tend to say, oh, it'll be fine. I don't need to go to the doctor. They're busy. I'm busy, but you then see them come in when things are not looking so good. And what does that look like?
Well, first, like I said, you kind of touched on it, the importance of if you are diabetic and you get a wound, you need to have that evaluated. Whether it looks like nothing, but it can be more
It goes
serious.
bad in a fairly quick way with infections, right?
Yes, infection is the number one cause of complicated wounds.
Okay.
And then in the worst case scenario, if we're talking about diabetics or any kind of wound, but is when they get, through that subcutaneous tissue into the muscle and into the vascular system, it can cause, a systemic, what we call sepsis. I mean, you can get really sick.
That's the worst case when it's all over your body.
Or it can get into the bone, what we call osteomyelitis, which, and most people know or have seen that, a lot of diabetics have amputations because that's usually, it's a full thickness wound. It gets into the bone and there's really, amputation is about all you can do.
So it's not the diabetes itself. It's not because the sugar is causing gangrene in their toes. It's actually usually started with a wound of some kind. Am I understanding that correctly?
Yeah, usually. Well, yeah. I mean, because the wounds happen because, the circulation just doesn't get down to the feet. Like as you get older, and with diabetics, it's a disease. So, and it can happen with an arterial disease or venous disease. If you decrease blood flow and oxygen and nutrients to the skin, it's going to break down.
Okay.
And it causes a wound.
So some of the wounds need some real cleaning up to get down to the layer that has the infection. Is that called debridement?
Yeah, debridement is very important to these what we call full thickness wounds.
Okay.
There's a lot of dead tissue. The tissue dies. So you have to clean that out to promote healing and promote blood flow. Like I said, most of these wounds, they heal by contracture, which means they, heal outside in.
Okay. And the good news is most of the diabetics, as we said, don't have a lot of feeling there. So even though it sounds pretty yucky, they aren't feeling anything as you're cleaning it out.
No, they're not.
Okay.
But then, the family members may notice it, or there could be a smell, which,
that's
is
a tip
indicative
off
of dead tissue, infection, drainage, that everybody, that nasty drainage stuff that smells, which is not a good sign.
Yeah, it's not going to get better on its own either, is it?
No. So what we'd like to do, what I can do is, when we work with the providers, through our doctors and nurse practitioners, we can treat the underlying cause, the diabetes. You need to control your blood sugar. So we can do lab tests. We can do x-rays to make sure it's not into the bone.
Ah, okay.
But then you treat the wound, on a daily or every other day. It just depends on the severity. But it's called debridement. You irrigate it out, you clean it out, you try to get some of that tissue out of there. And what I can do is selective debridement, which is kind of use a sharp instrument and kind of clean out some of the tissue. If it's too complex, we have to refer you to a specialist, a wound care specialist or a podiatrist.
Okay. And we have several wonderful groups in town.
Yes, we work through, through our We Care program or through, we do have a podiatrist now, working on a vascular surgeon. Like I said, a vascular surgeon is important when there's vascular disease. You may have to unclog those arteries. So you'll need specialty care. So we can refer you for that also.
And I'm glad you mentioned WeCare, because I know that a huge barrier to receiving care is the worry about financial issues. And working with WeCare, which is a pro bono group of wonderful physicians in our community across all different specialties that are willing to give up their time and their expertise to people who are either uninsured or don't have access to the kind of care that's needed through their insurances or lack of insurances. As well as we have referral specialists who work with the various groups around town or individuals around town, pairing up the kind of insurance plan you have with those folks that accept your insurance. So we firmly believe in the No Surprises Act, trying to get you paired up as quickly as possible with the care that you need if it's not through us. But again, an ounce of prevention is worth a pound of cure. And so I think the message that I'm getting is take a good look at yourself. And if you see something unusual, don't hesitate to call and ask for someone like Brett to take a look at it and figure it out. Now, you mentioned that you may have to look at things, or the treatment might have to go over several days. That doesn't mean they have to come in every day. I'm assuming that you would train their caregiver or someone, including the patient, how to rewrap or change bandages some of the time.
Yeah, I'm glad you brought that up. That's what I wanted to bring up. Is education is one of the main focuses of my job, is educating the patient. Yes, you don't have to come in every day to have a bandage change. Some bandages we can leave on for a week, and you can come back weekly. Some need to be changed every other day, but we can, hopefully, send you home with some dressings that we've worked through a direct relief to get some dressings. I'm in the process of doing that.
That's wonderful. Direct Relief is an organization that directly sends to nonprofit healthcare providers. It's sort of like the big box of healthcare, and we're very, very grateful to them. They have actually provided about $500,000 in supplies for us over the course of each year for the last 4 or 5 years. So if you hear the word Direct Relief, give a thumbs up to that group.
Yes, that's what we're working with them to get us some wound care supplies for people who may need it. But yeah, education is key. A lot of dietary factors play a huge role in wound care. You will need to, excuse you, I almost made it. Protein is a big building block for healing. For not just muscles, but skin too. So it's, we can kind of educate you to increase your protein sources. So you're okay.
Well, that is really good to know. And again, as we finish up here at our 24-minute mark, I want to thank you so much for being here today. Thank you for being patient with my cough. And I am done. Have a wonderful evening.